There are bones which are single. There are bones which are there are two bones. Like occipital bone is a single bone. Frontal bone is a single bone. Sphenoid bone is a single bone. The temporal bone, there are two temporal bones. And right and left. The zygomatic bone, two bones. And now this is the skull, which comprises of the frontal bone. These are the parietal bone. The bones which are on the lateral side, normal lateralis. And in the posterior aspect, this is the occipital bone. And your sphenoid bone from the this is the base of the skull. Now this is the sphenoid bone. It's a wing shaped. It's wing shaped. Okay. You have to know there are some holes are there. That structures passes through it. So you will be asked and with a stick, what structure passes through this? What structure passes through this? Not in detail how it goes and goes and goes and pairs this and that. It is not in so much detail you will be knowing. But you have to know the base of the skull, you have to know the full skull and the individual bones. Okay. And one thing I tell you, now on the lateral side, this is the parietal bone. Today's discussion is on parietal bone. Now this articulates, these sutures are there, and this the parietal bone is a quadrangular bone. This is, it articulates with the temporal, it articulates with the frontal, it articulates with the occipital, and the zygomatic process of the temporal bone, and this is the zygomatic. This is the orbit. These are the nasal bones. Okay, now parietal, it has a superior border, anterior border, posterior border, inferior border. And this is the angles. Now you see the inner surface. Now this is the protuberance over here. And the sutures are serrated. It is like, now the inner surface, there are some vascular, the vessels, blood vessels pass through it. And you see the anatomical position, see it has anteriorly the two angles are here, posteriorly the two angles are here. Now the posterior, there is a deep fissure, this thing due to sigmoid sinus. But over here the vascular pattern is more, that is on the anterior. You have to hold it like this. And this will it is like this. Okay? Then in the posterior aspect, it is the occipital bone. Okay? Now, this is the foramen magnum. এগুলো ভুল হবে না তোমাদের, হওয়া উচিত নয়। And when the occipital bone will be taught to you, now the foramen magnum, what structures passes to the foramen magnum? This is the question. Now I tell you the undersurface of the skull. Okay, now today you will do the parietal bone. You see the, I'll give it to you. Now here the temporal bone, it is, see, you will be seeing that it is the, when you see a temporal bone, hey, temporal bone একটা loose নিয়ে আসবি, the temporal bone, you will see that it is like this, but it is having the petrous part of the temporal bone, the mastoid part of the temporal bone, and the zygomatic part, the processes. This is the external auditory meatus. This is the external auditory meatus. This. This is কানের ফুটো. External auditory meatus. And this is the external auditory. This is the mastoid process. This is the mastoid process. Okay? Now, this is the occipital protuberance. এই যে occipital, হাত দাও, টিকে, এটা there's a protuberance, একটু উঁচু আছে, Now, this is the temporal bone. This is the petrous part of the temporal bone. This is inside the skull cavity. Now, this is the mastoid process. Okay? Now, you'll see this articulates with the parietal. And this is the mastoid process. This is the petrous part. If you hold it like this. Okay. Now I'll show you that this is the sigmoid sinus. The superior border, inferior border, anterior border, posterior border. Now it has surfaces. Convex surface. এরকম করে ধরবে এটা। এখানে যে এই যে the vascular markings here and sharp pointed, this is the anterior, like this, and this sigmoid sulcus is here, the pointed part is this, get it? The vessels are going like this. The markings. You just have to identify these major parts of this bone. There's no big, there are small, these emissary veins are there. There's a small opening. This will be in the emissary veins. I've showed you the lectured on scalp. These veins, they're communicating with, and then it goes into the sinuses, and that's why any injury to the head, any scalp injury, you have to give very good antibiotics, and because it gets infected, then there are chances of meningitis. In case of injury, you have to, first of all, I told you that bleeding, it bleeds much. Naturally, you have to toilet the wound and suture and toilet, and even you can do is that after suturing, in the emergency. You take one pouch of your shampoo, 1 rupee. You ask the party to bring shampoo and you wash. What happens actually, there's also bleed. Naturally, you tie, you bandage and leave it. But those clots and this thing becomes the needle surface. But shampoo won't go inside. This is one thing with khopri. Khopri is, I would say, khopri, skull. Skull bones are very tough. Especially Hindu, uh, this thing burning, the dead body is burnt. Naturally, they at times they now electric chulli is there, but if you go to the shashan in the villages, there's no, they with the bamboo they hit the dead body when it is in flames, but it's very difficult to hit the break the skull bone. This is one thing. Now you have to identify identify the parietal bone by their angles and their borders and the convex external surface, concave internal surface. These are the major things. And it is articulating with which bones? That is the infrontal bone, occipital bone, zygomatic bone, temporal bone, ekotai. And major part actually sphenoid is in the practicals won't be given. I'll confirm it on next class, because mostly it is I think from the examination point of view it's not so much important, but what happens ultimately, practical say the sphenoid now, but at the base of the skull you will be asked what is structures passing through this. Naturally you have to know, but you don't have to know the details. But what are the, like the greater wings, lesser wings, that where is the pituitary? That is one thing. Another thing is that now what we'll do is that you take your batch, you take here one parietal I've given. See how many bones are contributing to the skull. There are some paired bones and there are single bones are there. Now paired bones are your parietal and your temporal and zygomatic and the maxilla, and single bones are mandible, occipital, ঠিক আছে, sphenoid. একটু হাতে ধরে দেখো হ্যাঁ হলো এটা তো sphenoid, এটা occipital, this is the part of the occipital. কাটাটা দিলাম যে না এদিকে আছে না, দেখো দেখে নাও দেখো, this is the basilar part of the occipital bone. These are the two condyles. This is the foramen magnum. Now this part, I'll show you the base of the skull. You will see the body is fused with this portion of the sphenoid bone. These are multiple bones. Naturally, it is all joined by sutures. This is the frontal bone. This is the parietal bone. This is the parietal bone. The norma frontalis, norma lateralis. Lateralis is our এগুলো তোমার occipital bone, zygomatic bone. The posteriorly, the occipital norma occipitalis. ঠিক আছে? Now these are the bones that are only singular bones. singular bones. আরাম কর না, আরাম কর। Single bones and there are some are double bones. ঠিক আছে, দেখো, দেখে না, যত দেখবে দেখবে যত হাতে নিয়ে দেখবে তত ঠিক থাকবে। ম্যাডাম এখন ইয়েটা দেখো খালি, মানে প্যারাইটালটা দেখো, এটা তো অক্সিপিটাল বেস অফ দি স্কালের সাথে একটা স্কাল নেবে, একটা বেস অফ দি স্কাল নেবে, আর একটা ইন্ডিভিজুয়াল বোন নেবে। ইউ উইল টেক when you are in this thing, practical class, you still study head and neck in these batches. আমার প্র্যাকটিক্যাল হয়ে গেল, you go home, don't go home. So please, because Wednesday, today is Thursday, today in the afternoon you have class today, then you will go at 12:30 or 12. 12 nahi, 12, 11:41 to হয়ে গেল, 12:30. And on Wednesday, you are having what practicals? No class, no, or physiology, biochemistry. Biochemistry. Okay. But I'm telling you, after the syllabus is finished, you will come and according to your batches, and you just sit down over here. Which it is দেখা? কোনটা? এই তো। হ্যাঁ? না, this is the base of it. হ্যাঁ? না, see. না, ওটা কাটবো না, আমার কাটা আছে, আর কল দরকার সব কাটবো। আছে? Cut. How many skulls do you have? One. You want to cut it? No, no. If you want it to you want it to slice off.
No, I'm just asking, is it necessary?
No, no. See, if you want to see in detail, so one thing. If you want to keep it after anatomy for sadhana, tantra sadhana, then you keep the full. Or if you want to study anatomy, to see the base of the skull, you can take it, you can cut it for your own interest. I got admitted in 75, but I purchased a full skull in 1973, and that is still with me. But I have presented the skull to my guru. He is a tantra sadhak. Everyone's giving gold and everything. I gave him one human skull. Okay. Now, what I want to say is that you just, if you are interested, I will tell them. They will mark and get it. You, বুঝলি? ওদের কাছে একটা স্কাল আছে, সেই স্কালটা এরকম করে কেটে দেবে, দাগ দিয়ে কেটে দেবে। ঠিক আছে? You approach, everything is open. There's no secret lock. You want anything, you will get it. But you have to return it. And if it is your own, you come and if I am here, you bring it in the class, they will slice it in the electric shop. You and one thing I tell you, how many of you possess an atlas? Atlas. What atlas? Netter. Your netter. Or your netter. হ্যাঁ? ঠিক আছে, আজকে গিয়ে দেখে নেবে। ম্যাকবেন আছে, ম্যাকবেন। হ্যাঁ, you Macman's atlas is, see, Netter is my guru. It's all illustrated drawing, but Macman's atlas is all human. This thing, bones, all human bones, original bones. এখানে এটা ছোট্ট ইয়ে আছে, ফুটো আছে, সাইনাস। হ্যাঁ, এই দেখ, the emissary veins goes through this. আর এটা এদিক থেকে উঠছে, এখানে দেখ শ্যালো, and this is here, এটা একটু ভেঙে গেছে। এটা হচ্ছে anterior border, superior border, inferior border, posterior border. This is the your external surface. Convex is the internal surface. Concave, because it is accommodating the skull. Accommodating the brain. না থাকবেও ক্ষতি নেই। I can make mistakes. I'm not saying mistake, slip of tongue. Now, what is the function of the skull? You have to know. Function means it protects the brain, which is very soft, and some millions of neurons and are there, cells constitute the brain. That's why it needs a very good protective. When I started telling you earlier that every structure is supported by the bones, and in skull it is protecting the brain. So it is it is hard, and also it's very tough to break. आपको यार लोअर रॉड दिए मार ले तो ढक, that is a different issue. Now you see, এই দেখো, এটা দেখো 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 দেখো, নেড়ে চেড়ে দেখো বাবু, ফর্মুলাটা করো না তুমি, এক মাস করো আর ক্লাসগুলো হয়ে যাবে, পর 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 হয়ে যাবে। কিন্তু নেক্সট ক্লাস ওয়েডনেসডে, থার্সডে দুটো ক্লাস আমি নেবো, কারণ আজকের ক্লাসটা আমারই নেওয়ার কথা ছিল। আর অভিজিৎ স্যার কিন্তু আজকে ইন্সপেকশন হচ্ছে। अंडरस्टूड? कुछ तकलीफ है तो बोलो भाई, नहीं तो आपको मम्मी डैडी बोलेगा क्या इधर पढ़ाया शांति निकेतन में कोई अशांति हो गया, अशांति। शांति, ओम शांति, ओम शांति। ओके, अशांति तुम्हारा पिताजी आपसे करेंगे और आप मुझे गाली दोगे। You have to, it's very personal. Studies are very personal. No one can teach you. We can show you the path, but you have to walk. Naturally, practically, forget this exam result. Forget it. Whatever you've done, done. এটা নিয়ে না কি হবে রেজাল্ট পর্যন্ত ওয়েট করি দেখি, নো, gone. You're going by train, when you pass many stations, some station it stops, but once it's gone, you don't look back. This exam result, please don't get robust and panic and মন খারাপ, দুঃখ। So please, প্রজেকশনগুলো কাজ করছে না বা মাইক সিস্টেম কাজ করছে না, সেটা কাকে বলতে হবে? হ্যাঁ, রকি। Now please view and see